Okay, so I'm getting kind of tired. So I'm combining 2 days. So my day before my surgery day, I had to have a CT done. So I went back to the doctor. This was like Thursday because I was there on Tuesday for my first appointment. Got there on Thursday. Of course, they tried to put me on the CT scanner, which you sit to go on it, but you have to put your ankle at a 90-degree angle. And I was in a splint. And so the splint was too thick, so they were gonna have to cut the splint off. And I was begging, like, please don't cut the splint off. It hurts, it hurts, it hurts, it hurts, it hurts. I feel like the swelling is worse when you do that. It just has more pain. And they were like, well, we got to cut it off because the doctor has to see it because you're having surgery tomorrow. And it was just a whole thing. Anyway, so this nice man kind of calmed me down and reassured me and was like, we're going to do this together. I'm going to position your ankle. You're going to be fine. And as soon as we get you out of this CT, I'm going to take you and splint you so you can feel better. That's exactly what we did. We got it done. We had to do a few tries, but we got it done. And then he went and took me and put another splint back on. So that was great. The next day was going to be my surgery day. I'm going to just go ahead and go into that. So they called me at 3 or 4 o'clock that afternoon to tell me what time I needed to show up for surgery. I had an 8 a.m. for like a 9 or 10 a.m. surgery. I had to be there at 8 a.m., but whatever. And so, yeah, that's kind of what I had to do. And so, of course, they told me not to eat or drink, what medications not to take, check out my jewelry, do this, do that, dress like that, whatever the case may be, all on that phone call. And then, that was it. And like I said, the nurse, the provider, the PA I I got a call from Walgreens like at 8 o'clock at night saying that, oh, your meds are ready to pick up. Now, mind you, I was like, I ain't got no medicine. We picked up everything. But then it dawned on me that they said that they would put the medicines in a day ahead of time. That way they would have, the pharmacy had enough time to fill them. And when I needed them after surgery, I could pick them up pretty quickly. So I went to bed, washed myself up. By this time, my scooter had arrived. I think my scooter arrived on Wednesday. So my scooter arrived on Wednesday, and then my bedside commode arrived Thursday. And so let me tell you, those two products are a freaking game changer, life saver, whatever you want to call it. A scooter and a raised potty chair to go over the toilet have made my life amazing. I'm 5'8.5", so I'm a tall woman, and I needed those things. They would make my life so much better. So I'm telling you now, scooter, raise, bedside chair. Two other things that I'll add in there are these wedge pillows, triangle pillows. Those have been awesome as well for keeping my leg elevated. And then these little grabber things for when things are on the floor. Those have been the products that have saved my life. So there you have it. Here's a pre-op call.